baby?
Yeah.
Something's wrong.
Let's call the doctor.
But then also grieve what will never be. And that was the part of seeing the baby in the child's seat towards the end. Short, very powerful and profound. And as I said off the top, it's necessary. It's necessary that we see it so real and raw. And I know that many of you here have experienced it personally. And so we're going to begin our conversation and see what needs to be done, what we can all do to hopefully change these outcomes. We have the best of the best who have been through the worst of it all to share their stories, their insight, their courage, and how we can all get involved. So thank you. Thank you so much for being here, and thank you for having me. Anna, I would like to start with you. You were there during the making of this film, and it reflects a lot of what your family went through. For those in the audience who may not be familiar or close to the issue, can you share a bit more about your son, Owen, how your experience with his loss led you to the work that you're now doing with PUSH?
Thank you so much for having us talk about this issue, and for all your willingness to hear and see. Witnessing the tragedy that is stillbirth is very important for our movement for prevention. And sharing our individual stories also has so much power, so thank you for asking about my son Owen, who is my reason. He was my middle son. He actually was a textbook perfect pregnancy, so I had low risk care for that pregnancy. Everything was measuring normal, all of my appointments were great. I remember going in and being asked very vaguely, like, is he moving today? And I would always think, like, what weird things to ask, right? Because he's such an active baby, he moves so much. So I never thought anything of it. It was textbook perfect pregnancy. So as being on the set and you were asking about that, Samantha and I both went to Los Angeles to watch the filming, and the script, we already knew what was in it, right? So we were prepared, we already, all agreed it was well written. It was actually exactly what I envisioned. The duality that she showed back and forth is very powerful. But we were just there thinking, they're not gonna get this right. There's no way these actors are gonna know how to act this out. But in reality, it is what we experienced. We were blindsided by the stillbirth, the majority of every mother that I know, because we had no risk factors. 81% of moms that experience a stillbirth have no risk factors at the beginning of the pregnancy. So we're falling in this gap of care that it's not addressing what needs to be addressed. And what ended up killing my son was actually cord compressions that happened at the end of the pregnancy. Now, imagine, because he was such an active baby, they weren't actually looking at the cord at all, and had they looked, he actually had a short cord, half the length it should have been. And it was becoming hypercoiled, like when you have your hair dryer, get stuck and get the kinks, it's not maybe working so well, you start to unravel it. Well, unfortunately, he was raveling more and more, and those compressions all of a sudden were taking the oxygen that he needed and the nutrients he needed, and I didn't know. How would I know this, right? I was going through my care, trusting my providers that they were doing what was needed. And at the end of the day, he was dying and I didn't know it. So actually, similar to the film, and Margie and I related this, our children died in birth. So it's very, very emotional to witness, the other outcome that could have been, and obviously the one that we got, which is that they were too late. My son was not resuscitated in time. And I carried his bear around. Actually, this was something that was gifted to me by a company that makes them in the length and the weight of your baby. If you want to hold him or stuff, I take him to meet legislators actually here in DC. So as a physical representation of what we're talking about, because this is not just a pregnancy loss, like I think people really don't want to even think about how horrible it is. You give birth to a baby like this, and then you have to let that baby go. And that's the weight of my son. So truly he could have made it had he been delivered on time. And so that's why we're showing this critical moment where something is missed, or something can be captured. And we do talk a lot about fetal movement, but at PUSH, we like to push a little further than that. It shouldn't be all on the parent's shoulder to notice this fetal movement change. That is the last moment. We were in that moment. We almost made it. And she was giving birth. It can happen in birth. So it should be that it's all on the mom to notice these changes. We should be looking at the cord. We should be looking at the placenta. There are signs, and these are the things that really do lead to stillbirth, and it's not something that the mother did wrong. There's something more we could have
with them.
Things that are preventable, and sometimes you don't know what you don't know. So it's critically important, and he still counts.
Yeah.
I saw that. Still.
Just looking
Owen,
for-
Nathaniel.
Yeah, the only thing I ever bought him really, because he was my second, so I was just prepared for easy birth, using the hand-me-downs from his sister, and she was really excited to be a big sister, so it's a very painful experience for the whole family, and my husband experiencing it on the other side, as the partners do. They don't know what to do, they don't have any control, it's incredibly traumatizing to them. I mean, they can't even speak about it sometimes.
Well, Marjorie, since we're shifting here naturally, I want to get you on some of what Anna said, but also both as a mother and as a therapist, I want to know what you think is missing in our healthcare system when it comes to women, and particularly Black women, and what they face during pregnancy, because we know that they face a much higher case and rates of stillbirth than their white counterparts.
Thank you for the question. To put things into perspective, my son Alexei was born still September 27, 2004. So he would have been 21 years old this year. And so here we are still talking and fighting for the same thing. One of the statistics that Sam did not give is that recently CDC came out with data, and maternal mortality has lowered for every demographic except for Black women. And so therefore, this is something that is a national crisis, but unfortunately is not perceived as a national crisis. And Black women are 3 times as likely to experience stillbirth, 5 times as likely to die from giving birth. To put more perspective into it, my sister, 27 years ago, died 5 days after giving birth. And so this is something that is ongoing. Black women are dealing with, there's a lot of factors that go into what the things that we deal with. We're dealing with stress of racism, we're dealing with lack of health care, we're dealing with so many things. But truth of the matter is, until our nation, right, take us Black bodies as important and see this as a national crisis, nothing will change. And we will continue to fight, we will continue to raise our voices, but as a nation, we need to see this as a crisis, right? Because I always feel like, I say, that what happens to one of us happens to all of us. Happens to all of us, and it has to be seen as that.
Marjorie, just a couple of days ago, I interviewed Lisa Price. She's the founder of Carol's Daughter, which is a hugely popular natural hair care company based out of New York. And she's done a lot in the Black maternal health care space. And she said that she believes it is based on race and racial stereotypes. I believe Sam mentioned that. And she said there's this idea that Black women can handle pain more or better or tolerate it more. Do you see that?
I believe that. In particularly my own story, 21 years ago, I gave birth in a birthing center, and I was told, I had a conversation with my midwife, she said, at any time, if you feel like you can't handle it anymore, let me know and I'll take you upstairs to the medical room, and to the hospital, and we'll give you pain medication. Well, that didn't happen. And so a trust was ruptured. My trust in her was ruptured. And I was like, I can't do this. And she was just not present, and she didn't listen to me. And that's the other thing that Black women go through. We're just not heard, right? And the truth is, had she listened to me, we would have gotten to him quicker. The situation was so dire in my situation that they began to cut me before I was even under. That's how fast they were trying to get to him. And so this is the stories, and many stories of what Black women have to deal with on a daily basis. And we're realizing that Black women don't even want to give birth. We're afraid. We're afraid to go to the hospitals. We're afraid because we may not return home.
That's a harsh reality. Liz, you lead national awareness efforts with PUSH. Tell us more about the Stillness is an Illness campaign and what it stands for, and why this message is so important at this time.
Yeah, so I think the film says a lot, right? I remember for my situation, I hadn't felt Aaliyah move all day, but again, similar to in the film, I was low risk, I was healthy, everything's fine. You don't know, you said this earlier, which is always my line, you don't know what you don't know. And similar to Sam, I thought I knew a lot. I was educated, I am an educated woman, her father's an educated man, surely we are good to go. But there's so much that we don't know. And in stepping into this space now, part of the reason I'm very involved with bereavement, as many of you know, but it is equally important for me to be involved in prevention because Aaliyah's stillbirth may have been preventable. We are not saying that all are preventable, which I really want to make clear, especially to those that make the rules. We're not saying that all stillbirths are preventable, but many are, and you have got to listen to the expectant person. Nobody, a lot of things, and we talk about this a lot at PUSH, a lot of first-time moms worry that they are going to bother their doctor, they're going to bother the nurse. We need to throw that notion out the window because that was one of my concerns. I don't want to bother anyone, it's right after Thanksgiving. Had I made a call, had I known to make a call, our situation could be different. So I think with stillness as an illness, just empowering an expectant person is so powerful, and shedding that fear of being annoying or asking too many questions. I mean, we want to empower moms to be able to speak up for themselves. We want to empower partners to help their partner speak up for themselves. A lot goes into it, but I think at the root of it all, it's about listening to your body and communicating how you're feeling with your provider. Because, I say this all the time, I had no idea that stillbirth still happened, especially with someone so healthy. And, the reality is just so different, as I've learned. And we can make this change, and PUSH is making this change.
Yeah, big changes for sure. Dr. Harris, you bring both public health expertise as well as your own personal experience with this to the table. How do both of those inform what you do and how you treat patients in the field?
So I'm on the research side, so I don't treat, but I do work as a birth advocate and a doula. So in terms of, I would say, my lived experience, as you mentioned, it's highly, I had the same experience. So in terms of being cut without the anesthesia at the same time. So it's like, you're getting ready to go out, but you feel, you feel the burn coming. And so, I just know that in terms of my lived experience and how we address this work, we just have to look at the entire picture. And the system, birth is about business in this country. It's the one place where we give our power away, right? We know very little about birth, as you said. You don't know what you don't know. And when you enter that birth space, you are just entrusting a system to tell you about your body and your care. So that's the first thing in terms of like my lived experience and how I address this work, is that we have to change the culture around how we are approaching birth and the birth process way before we were pregnant. I also I'm an extractor for maternal mortality review committees, and so I will say that when you were breaking down the numbers in terms of that 3 to 5 times more likely, we say 3 to 5 times more likely, but what that looks like for Black women, what the numbers break down and look like is really high rates of preeclampsia, and that placental abruption, which can often cause that stillbirth, is your blood pressure is so high that your placenta starts to separate from your uterus, and then your baby loses oxygen. So I'm seeing many cases where you'll see like placental abruption, stillbirth. The other part that we miss is the maternal mental health piece, which is really important. You have a stillbirth, the mental health implications of that are drastic, and we often the treatment and care to deal with that as well. You know, maternal mental health is one of the #1 leading causes of maternal death in this country. So like all these other issues kind of compile on, so you really have to look at the whole picture here. So the reviews I'm seeing are also a lot of ODs, you know, a lot of issues that are just taking this situation to the next level. And so we have to think of the whole picture, the whole life course perspective, I always say, in terms of how we're ending up in this situation as well. I think for me, the reason I'm here is because I had a white friend, a white resident I went to high school with. And when I got home from the hospital and I told him that I was sick, like I didn't feel well, and I had, similar to the movie, I called the nurse's station and said, you know, I'm home from the hospital, I had a stillbirth, I have blurry vision, like I'm trying to do work on the computer, I can't see the words on the computer. And she was like, oh, you just have a lot of swelling and inflammation and trauma, just give yourself a minute. And so my friend that was a resident at the same hospital I delivered called and said, what's going on, how are you feeling? And I said, you know, I have a really bad headache and I can't see the computer, like I just see blotches. And so he ran over and picked me up and wheeled me in, and my blood pressure was so high, like it was stroke level, like I would have died that night if he didn't come and get me. And so, you know, I'm sure his race as well as his privileges at the hospital got me seen immediately.
Wow.
And so like all of these factors combined, we don't consider the whole person. We always forget the mental toll that this takes on us and our families as well, and the amount of healing that it takes to recover as well, the trauma that you're gonna live with for a really long time.
You mentioned mental health. I'm curious to know, Dr. Harris, what can be done at a policy level to improve the outcomes for women and for the babies?
So from a policy level, oh my God, we've been pushing so many bills. You know, we have the Momnibus package, which is a package of 14 bills for comprehensive care for moms. We also have, we've had some progress made. You know, we have national hotlines now for maternal mental health that you can call. Adrian, you wanna help me out a little on the TLC?
Mama TLC.
TLC. Yes, that's in many different languages that you can call. So I feel like we've made some strides there. You know, we have the Mommies Act. We have a lot of bipartisan bills that work to increase the birth workforce, which is really important in terms of closing some of these gaps. Especially, I'm sorry you had that horrible experience with your midwife. I don't hear that often.
Yes,
But it happens, it does happen. But you know, increasing the workforce in terms of midwives and doulas, also trainings for clinicians, doctors. We are very low on perinatal mental health support. And so like increasing the birth workforce, paid leave, right? That's a big one. And just in this country, we don't want to pay for care. I don't know what that's about, but the world cannot run without us caring for each other. Yet it's the one thing we don't want to pay for. I just don't understand it, and that leads to so many other issues. Yeah.
Well, I'm gonna open it up to questions in just a bit, but I wanna do a final one for all of our panelists. Liz, I'll start with you. What do you hope that everyone will take away and understand more and perhaps better about stillbirth?
A lot. I mean, I think there's still such a misunderstanding that this is preventable. And for everyone in this room, it is now our job to go out there and tell all these other people that don't really believe that stillbirth can be preventable that it is in fact preventable for many families. Because, you know, again, the pushback on that is very unfair to families that have experienced this. So I'm going to give you all a task to tell some people in the next week or two about this event, about PUSH, and about the fact that we can save more babies' lives.
Dr. Harris, we'll go way back this way. Something you want people to understand and know about stillbirth that.
I think one thing I want people to understand and know is that, yeah, I'm trying to think about that. What do I want you to understand and know? I think that, I always kind of talk to the families and say, like, it's not your fault. And that's just like a huge part of the grief process and the blame and the shame around stillbirth is like, it's really not your fault. And I say that to our communities, because for me, I got a lot of, well, were you stressed? Like these questions about what I could have done better or different, and we're gonna ask us those questions a million times over, like whatever question, like I really thought it was the fish sandwich I had from McDonald's that could have caused. I mean, that's ridiculous, but this is how far you go in terms of trying to figure out as a mom, like, what did I do? Like, I couldn't, you know, it must have been something I did to not bring my baby here. So I would just say, it's not your fault, and that goes a long way. So even if you're not a mom, if you can tell another mom, like just know it was not your fault, and don't ask silly questions about what happened the day before. Or did you do this? Did you do that? Like it's really not. And so that's really my takeaway. That and my mantra. That yeah, I still work on it for myself. Actually, I still work on it.
I'll piggyback because that's me too. So my important takeaway for anyone, especially for those in the loss community, is that there is a feeling of guilt that we carry after a loss that is very unfair, and a lot of times that comes from the medical side of things because we aren't given answers. As my story reflected, it took me 5 years to find out a cause for my son, and that isn't acceptable to me. I think that the medical system needs some accountability on that end in terms of policies. We are looking forward to hopefully working with systems that are in place and maybe providing new opportunities for us to have that accountability, because we do pay for this. This is a service-based business. And I don't know any other service that you can provide where you can ultimately fail this drastically and still get paid, and we do pay still. So we need to make sure that parents are given the answers that they deserve. Autopsies should be included or recommended, and of course that's a preference for the family, but there are other ways, non-invasive ways to find information. The placenta pathology, that's a very non-invasive situation, but we don't have enough trained pathologists in our country, so we are pushing for legislation for that. There's a Shine for Autumn Act. We've been working on that for several years, supporting Debbie on that bill, and that is a very important bill because we are not collecting the data properly for these deaths, and we do believe every baby still counts. My son's death matters. He died from a cause which currently is not in the national data. They rush the process to give you your baby so you can bury or cremate, which I understand, but then they need to come back. They need to update the records, and it shouldn't be on the parents to do that. And even though I've asked for that, my doctors have refused. They asked their lawyers, they're not doing it for us. So currently Owen died of a natural cause. Why would a baby naturally die in the womb where they're supposed to be safe? It's not true, and I want that fixed. I'm still fighting for it. So this is something that I think will really help parents in the lost community to be able to be advocates like us. Because before I knew what happened to him, I wasn't an advocate. I didn't know what to say. As you mentioned, I was looking at everything. What did I do the week before? What could I have noticed? Is the change in movement, was I not fast enough? You know, but it shouldn't be left up to me to catch all these internal issues that are happening that they can be tracking for me in the pregnancy. And I am paying for that. I believe that when I hire somebody and they are a professional, that they are going to give me what I'm paying for. I'm not supposed to go to medical school to be a mom. So why did I feel like that afterwards? I know more than I should right now. I've read every research paper. At this point, I know more than a lot of people about stillbirth and prevention and medical. I mean, I can sit here with people and I'm hearing these talks of your symptoms, and I understand them now, I know them, but when you go into pregnancy, you don't come in with that knowledge because you assume your care team will do that for you and take care of you. So I think it is a lot on the other end of these things that we need to continue to push for.
what's there left to say, right? Takeaway. I think one of the most powerful things I find on 9/11 is when they say the names, that every family member comes up and they say and they speak the name of their family member. And I think that's very powerful because we live in a society that kind of like to give numbers. Oh, 2,000 people died. But what they don't realize is that that's someone's family member, that was someone's mom, that was someone's cousin, and they mattered, right? And I think what I want people to know is, these are our children. Alexei, that's his name. London, Alana, Heath, Aaliyah, Owen, they all matter. They're not just numbers. TJ, sorry, TJ. She couldn't be here. TJ, they all matter, right? And I think once we start to see them as our children, as our people, as human beings that should be here, then we'd mobilize quicker, right? And so we need our policymakers to mobilize, right? To see Black faces, to see Black bodies as important, right? And to see children dying as important as well.
Hugely powerful. I think we can all agree that it needs to happen to the 10th degree. So thank you. Do we have any questions or comments even from the audience? If so, please stand and we'll make sure that we include you in the conversation.
Thank you all for being here. One thing that we didn't go into detail on is what is the doctor's part in all this, and how can they be preventing stillbirth? Because as we said, it's not all on the mom. It shouldn't be.
I think one important thing that I can respond to that is one of the things that I say is like, you get on an airplane and they tell you how to prepare if there's an emergency, right? And I think a lot of times medical providers are afraid to talk about stillbirth because they think they're going to scare the families. But I think I would rather know than not know. Similarly with Liz, I didn't know about stillbirth, and I think had I known, I would have been more prevalent, or it would have been more prevalent in my mind. I'd be more aware. I'd be paying attention more. I just assumed it's like my first pregnancy. What could go wrong, right? And so just like we prepare people for just in case there's an emergency on an airplane, it's the same way that we should prepare families when as soon as they know that they're pregnant, listen, these are the things that you need to look out for.
And I'll just add to that, we're all told to not eat sushi and cold cuts. We say that a lot on our team, but it's I didn't eat any of that stuff, so I thought I was good, but I didn't know about increase in movement, rapid movement, right? Why didn't anyone tell me that? I know not to eat an Italian sandwich, but I don't know about an increase in movement and what that could mean. And that would not have scared me.
Right.
That would have educated me. But we can do that for families. It's not that hard.
Yeah, I just think we're also, thank you for mentioning Shine for Autumn. That was definitely a brain fart on my part. The Shine for Autumn Act is also so important because that research and that education piece that's a part of that bill, that there's so much we don't know, and I think there's a lot that doctors don't know as well. But at the same time, I think we also have to recognize that we're in a burnt out system. So doctors, we need to increase different kinds of birth workers and supports to support doctors. I think we really can't rely on them to do all these things for us. The way the system is designed, it's impossible for them to do that, So I also feel like, integration of midwives and doulas and continuum of care, a lot of that is also about the relationships that you have with your support staff and the relationships that you're building a rapport, that relationship, and they'll be like, oh yeah, this is all for, let me tell you about this, but when they're running through us like machines, they're missing a lot of stuff. I'm sure a lot of stuff could have happened to me that they didn't tell me about or just missed. And so I think we also have to look at the system of care that we're in that doesn't allow for all of these things to happen. And we have to expand that system of care. It's not working for us. And the way doctors are right now, they get, 10 minutes with us? So it's just like whatever comes to the top of their heads, and so I think that's just the hard part, but we do need continual education. There should be trainings for nurses. Nurses spend the most time with us, even in the prenatal visits. So I think more training for nurses around stillbirth, and the stats needs to happen. A lot of doctors don't even know the stats in their hospital. They don't know their C-section rates. They don't know, they don't know this information. So that's a part of it as well. Thanks for asking that.
And I know you wanted to speak on this.
I wanted
too
to
before
bit
we wrap.
because we experienced pregnancy after lost care, which is, unfortunately, you have to lose the baby before you're admitted to this very higher standard of care. And the interesting thing after I lost my son is that they started to offer a lot more scans, and they told me, if you're worried at all, come in and we'll do an NST. And I was already worried. Granted, I've already been through this death. So if any providers are here and you're worried about worrying a parent again, we just want to recommend that you still tell them, you still inform them, because they don't need to go through this to then have the worry, to then go through the whole pregnancy again. We shouldn't have to lose a child to get that level of care and that information that could be life-saving.
Well, I think this has been a life-changing and maybe even life-saving event for people today, and I thank you all for coming out. And if you were moved by this film, as I believe I was, I believe many of you in the room were, you can still support the conversation. Just go to pushpregnancy.org. That's pushpregnancy.org. You can also follow them on Instagram as well. They're very active on IG too. So thank you all for coming out, and all of you ladies, thank you for your stories, for your determination and your courage. It means the world. And I know that your babies are smiling from above. And I know they're here with us even tonight. So thank you. And thank you for having me.